Swadikap and good afternoon once again. Today is Friday, the 16th of April 2021, and this is the English language summary of the daily press briefing here at the CCSA. So as you would know, we had the general CCSA meeting this afternoon, wherein the Prime Minister was chair of that meeting. After the meeting, he came out and spoke to the press on this podium, summarizing the results of the meeting, the resolution of the CCSA regarding the new measures, and we had Dr. Tui Sin give us the Thai language edition of the summary, and I'll go a little bit into detail of that in due course. But first of all, the CCSA had considered new regulations under the emergency decree according to the new situation and the new context, as we all know by now. These new regulations will be effective on Sunday morning, meaning at 12 midnight, 2400 hours on Sunday. So that's Saturday night and Sunday morning, starting on Sunday morning for at least around 2 weeks, pending further assessment. Now, just some keywords first, to put that out first, is that the meeting resolved that there will be no curfew, and I'll go into detail of that later. No curfew, but advising everyone to reduce travel and reduce movement. So first keyword is no curfew. The second keyword, which I believe that everyone would be waiting to hear, is about restaurants as well, that no alcohol can be sold or consumed in restaurants, but of course take home and consumed at home will be fine. So just to put that out forward, and I'll go into detail of some of these measures. First of all, the general situation and number of cases that we have for today. 1,582 cases recorded for today, wherein of that number, 656 cases are from active case finding, 921 from local transmission, and 5 from those traveling from abroad and in the state quarantine. So currently, as you would know, the past days and weeks, we had found a lot of active cases, a lot of positive cases. We have active cases currently being treated now standing at 10,461 with no new fatalities. Obviously, the number of recoveries now is way lower than the number of new cases per day. So on the situation as of today, the Health Ministry had reported that since the beginning of this current outbreak, the confirmed cases have now been found in all 77 provinces of Thailand. So this outbreak had actually affected all provinces, all localities, all regions in Thailand rather. In the past, we had been counting that 15, 11, 9, 7 provinces had been COVID-free. Now, because of the travel of people that are positive from COVID from various clusters, for example, in Bangkok, traveling back to the provinces, this has caused the situation to be that all 77 provinces of Thailand have now reported cases. The number of new cases is increasing to date due to the infections among family members, among colleagues at workplaces, among schools, and those in contact with previous cases linked to crowded places in many areas, as you would know, including entertainment venues, parties, seminars, and camps. So as this infection rate is higher among younger persons, the virus is able to spread to wider areas due to the high and frequent movement rates of people. Now, the highest number of new cases found today is in Bangkok, with 312 new patients, bringing the total number of cases found since the 1st of April to 2,697 in Bangkok, as you can see on screen. Followed by Chiang Mai with 272 new, Chonburi with 111, and Prachuap Khiri Khan with 100. Now, the Disease Control Department has further reported that there are several new clusters found across the country. In Chiang Mai, 34 patients are found to be related to a university students camp. In Nonthaburi, a seminar has been linked to 19 new patients. And entertainment venues in Nakhon Sawan, Songkhla, and Nakhon Ratchasima provinces have also accounted for numbers of infections. And moreover, the Department of Disease Control has found several confirmed cases among teachers and students in schools in the provinces of Kanchanaburi, Chantaburi, Chonburi, Samut Prakan, and Krabi. So therefore, the CCSA has to impose appropriate measures to curb the transmissions in these areas and venues. So this afternoon, as I mentioned, the Prime Minister chaired the general meeting of the CCSA. The meeting discussed a number of measures to control the virus while minimizing the impact on the livelihood. So therefore, it has been agreed to recategorize the COVID-19 zoning areas and measures for all provinces, which 18 provinces are categorized as maximum controlled areas, and 59, the rest of the provinces, minus the 18 provinces, will be classified as the controlled area category. And you see that on screen. The red ones are the provinces that are maximum controlled areas, 18 provinces, and the remaining other provinces, 59 in orange, are the controlled areas. And there's a slight difference in the measures for these two groups. So the maximum controlled area, as you see on screen, red zone, covering 18 provinces, Bangkok, Chiang Mai, Chonburi, Samut Prakan, Prachuap Khiri Khan, Samut Sakhon, Pathum Thani, Nakhon Pathom, Phuket, Nakhon Ratchasima, Nonthaburi, Songkhla, Tak, Udon Thani, Suphanburi, Sa Kaeo, Rayong, and Khon Kaen provinces, and the remaining 59 in the controlled area or the orange zone. Now, just to recap again that nationwide, nationally, there is no curfew. That's the key word, no curfew, and the Prime Minister has stressed this just now in his delivery of his statement. No curfew. The key word is encouraging to reduce travel and reduce movement, particularly in times at nighttime. So that's around 2300 hours to 0400 hours, 11 p.m. to 4 a.m. That's the time that the CCSA encourages everybody to reduce their travel. Of course, it's not banned, it's not prohibited, but the encouragement is to reduce travel and reduce movement in those times. So nationwide measures will include the closure of all entertainment places, such as pubs and bars. And as I mentioned, alcoholic drinks will be banned in all restaurants, not to be served or consumed in restaurants. And any gathering of more than 50 people will also be prohibited unless having been approved by the Provincial Communicable Disease Committee. And these 50 people, even if you are family members. Now, all educational institutions will also be closed, as well as amusement parks and indoor playgrounds. And when I say all educational institutions, that means for physical learning. Of course, right now the learning mode would be more of online learning. So physical learning will be not be allowed in all educational institutions as a nationwide measure, at least until the 30th of April 2021. Also, as a nationwide measure, all shopping malls will be ordered to be closed at 9 p.m. Now that's for the nationwide measures. Now, particularly for the maximum controlled area or red zones, it has been resolved that in addition to the nationwide measures, particularly for the red zones, the convenience stores and supermarkets that operate 24 hours a day will be closed from 11 p.m. to 4 a.m. the next morning. So, for example, convenience stores, corner stores, 7-Eleven, usually 24 hours, they will be closed from 11 p.m. to 4 a.m. in the maximum controlled areas. In addition, for maximum controlled areas, the gyms and fitnesses will be allowed to be opened only until 2100 hours or 9 p.m. So that is clear. So I recapped on the nationwide measures and two additional measures for the maximum controlled areas for convenience stores and gyms and fitnesses. Now, in the maximum controlled areas or the red zones, for restaurants in particular, restaurants, as I mentioned, will be closed at 9 p.m. in the maximum controlled red zones. You can see that on screen. Closed at 9 p.m., but they will be able to receive takeaway orders until 11 p.m. On the other hand, in the controlled area or orange zones, the restaurants will be able to receive customers until 11 p.m. And all measures are set to be imposed from the 18th of April, early morning, this Sunday, and will be implemented for at least 2 weeks. So we encourage all public and private agencies, organizations to also allow employees to work from home, WFH, work from home, at the maximum capacity, the highest degree of work from home as much as possible, to curtail the risk of infection in the workplace and to reduce contact between people and office mates. The CCSA also advises against inter-provincial travel for the time being, as well as to minimize movement, as I mentioned, between 11 p.m. to 4 a.m. to reduce nighttime gathering. So no curfew, but it's highly encouraged to reduce and minimize movement and travel during these times. On the hospital beds and vaccination, I'll mention that a little bit because it was mentioned in the meeting. On hospital beds, the Health Ministry has ensured that there are sufficient hospital beds for patients. The management of the lack of the beds has been thorough. About 8,000 beds in hospitals, hospitals, and field hospitals have been prepared in addition for COVID cases in Greater Bangkok. And also about 6,000 beds are at existing hospitals and hospitals, 700 beds in the field hospitals in the Bangkok Metropolitan Administration, in Bang Khun Tien and Bang Bon districts, and 1,000 beds at the field hospitals in Bangkok Arena and Nong Chok districts. So more field hospitals are being built, being set up across the country, as you may have already learned in media, in the news. So the Public Health Ministry reaffirms that its policy that all infected persons must be hospitalized, put into medical treatment in order to reduce the risk of community transmission. So it's not that if one finds any symptoms and is tested for COVID, he or she would be self-quarantining at home. That's wrong. That person should be seeking medical treatment. And those waiting for hospital beds can contact the hotline numbers, you see that on screen, to find availability of the nearest medical facilities. On vaccination, we'll go into that a little bit more in detail tomorrow. But today, I'll just give you a couple of numbers. So far, more than 510,000 persons have received the first dose of the COVID vaccine, and over 75,000 have received the second dose and are fully vaccinated. Of the vaccinated persons, more than 40% are health workers currently. The Ministry of Public Health is also starting to distribute the 1 million doses of Sinovac vaccines that has arrived in Thailand after having received it recently this month. Meanwhile, the Labor Ministry will also be providing free COVID tests to members of the Social Security Scheme. This program will start on the 17th in Bangkok's Dindang district. And those who are in risk groups can receive the COVID vaccine for free. So this is from the Ministry of Labor. And this initiative is a joint cooperation of the Interior and Labor Ministries to curb the spread in the Bangkok area, especially those workers who have just returned from a trip to their hometowns after the Songkran holidays. And tomorrow we'll talk more about vaccines. So I've recapped to you the gist of the meeting, the new regulations according to the emergency decree that has just been approved at the General CCSA meeting just now. It has been recapped by the Prime Minister and Dr. Tawisin as well regarding the various measures regarding restaurants, regarding schools, regarding pubs and bars and the like, and especially the minimizing the movement and minimizing travel as a precaution. Just before closing, I'd just like to say that the Ministry of Public Health, in cooperation with Ratchavithi Hospital in Bangkok, has provided an online risk assessment form. You see that in the infographic on screen, and I believe there's a link there as well, for self-evaluation purposes before considering to visit the hospital to test for COVID infection. This self-assessment tool is available in Thai, in English, in Burmese and Chinese in order to encourage people to be more aware of their self-protection from high risks and to reduce unnecessary hospital visits. So as we continue to see the number of new cases found in Bangkok metropolitan area and elsewhere rise, I would like to remind the basic yet important tips to prevent COVID, which is DMHTT. These measures continue to add strength to our efforts to overcome this pandemic together. And just before closing, I'd just like to quote some things that the Prime Minister had just said on this podium just a few moments ago. He said that Thais are special because we are one. We can be one, and we can solve any difficult problem together. He also said, quote, Thailand will win. We need brave people, we need brave citizens in Thailand in these very difficult and these trying times. End of quote. So, I believe I've done my duty for today. You can perhaps make use of the information provided and follow the other information, the updated information in the English language news and in our social media. I'd like to say that please take our information with an open heart. Some of you may, as the Prime Minister mentioned, may not agree with some of the measures, may not agree with some of the actions of the CCSA, may have a lot of difficulties, but rest assured that the CCSA and the Thai government and Thailand is well aware of the various needs, and we're well aware of the various difficulties that everyone is facing, not only Thai citizens, but also those foreign nationals who work in Thailand, who live in Thailand, and who call Thailand home. I'll just give you one short example. When we talked about education in the CCSA meeting just now, the health minister actually raised an important issue that may be useful to the expat community, and the CCSA was aware of that issue, and will take the issue to heart and try to solve the issue case by case. That issue is about that we're aware that international schools in Thailand usually conduct testings in the same time as other schools around the world. It may be a placement test, it would be a college examination test, and conducted in various international schools around the world, and in the same time as international schools in Thailand as well. Now the question was that if these testings had to be done in a physical mode and the number of students taking these tests exceed 50 persons, would that be allowed? Because as you recall, one of the regulations, new regulations we have is that any gathering of more than 50 people will also be prohibited unless having been approved, including family members over 50 people. So the answer is that CCSA is aware of these issues, and we will be considering it on a case-by-case basis to the benefit of our schools, international schools, the Thai schools, the curriculum, our students, and our future. So just to end, I'd just like to say that from today on until the end of April, most likely we will be having the daily press briefing to the word. So daily press briefing on a daily basis, not anymore on Monday, Wednesday, Friday. So we will have the briefing on weekends as well, every day, because of the new situation, the context, and the need for us to communicate directly with you as our audience, our Thai citizens and our friends, those who call Thailand home, in the most effective way that we think is the most beneficial and useful to you, so that we can help each other solve this issue, solve COVID, and keep the numbers low and stay safe together. So I won't say see you Monday. I'll say thank you very much for your attention. I'll see you tomorrow on the weekend. สวัสดีครับ
ครับขอบคุณ